Are you having a swelling at your belly button or in the groin or any previous surgical scar and that's growing with size over time? Then it's hernia. I am Dr. Kona Lakshmi, Minimal Access Bariatric and Metabolic Surgeon, Yashoda Hospitals, Hyderabad. First, let us understand what is hernia. Hernia is a weakening of the abdominal muscle walls through which your intestines try to bulge outside. So the bulge what you are seeing on your abdomen or in the groin is actually your intestines or the fat layer over the intestine, which is trying to force its way out through the gap in the muscles, which might have been natural weak areas which are there in everyone, or your previous surgical scars, sutures have started becoming loose because of various reasons like obesity, or your muscles are genetically weak, or you are having problems like chronic cough and constipation, which is constantly straining and weakening the muscle. Now, once a hernia has happened, what is the treatment? There is no medical treatment for hernia. All hernias have to be treated surgically. So earlier, hernias used to be treated with open surgeries. So it used to be a lot painful and used to have lot of skin problems because of the big cuts needed to treat these hernias. But now times have changed. We have come into the era of minimal access and robotic surgeries. So with minimal access and robotic surgeries, we are able to treat these hernias irrespective of the size and the location, minimal access way. That is 3 small cuts and your surgery is done. With robotic platforms, the surgery becomes very more finer, super fine, and more complex hernias are being dealt easily with robotic platforms. Earlier, sometimes in spite of having minimal access surgery equipment, we had to convert some of the hernias to open surgery because of the difficult location. But with robotic platforms, we do them all minimal access way. So your results depend on 3 factors. One is how much the skill your surgeon is, and then how strong are your muscles, and then what is the quality of the mesh and materials used for treating the hernia. So coming to the skill factor, yes, not everyone can be super skilled, but few of the surgeons have really good skill or have achieved good skill with lot of hard work and all, and definitely their results are better than the average surgeon. And then coming to the patient, if the patient is morbidly obese, definitely even the best surgeon cannot give you the good result. Or you are having problems like chronic cough and constipation, so which need to be treated before you come for your hernia surgery. And then coming to the mesh and material. If you have a good surgeon, a good patient with good muscles, but your mesh quality is low, or your mesh size is smaller, or your place where your surgery is being done hasn't following the gold standard in sterilization techniques, then yes, we have problems. Small mesh causes recurrence. If it is a bad quality mesh, then it can split or rupture and cause recurrence. If the sterility process is not followed diligently, the mesh can get infected. So all these things have to be taken into consideration when you're getting your hernia done. Don't treat your hernia surgery very lightly or opt for someone who says that, come on, I'll do the same surgery for less. There is nothing cheap in this world. Good quality life or good quality treatment comes with a cost, but that cost will save multiple costs in the future by cutting down the number of chances your hernia is going to recur, or any mesh infection which can happen, which can trouble you a lot, and you may end up spending more than what you had bargained for. So always choose a good center, good skilled surgeon with a good hospital infrastructural setup, and always opt for a good quality, good size mesh to have a safe and a recurrence-free hernia repair. Thank you.
Like, comment, and subscribe for more health updates.